All right, all right. What's going on, y'all? It is yours truly, Dr. Pierre, your favorite board certified internist. Welcome to another episode of Real Physician Reacts. If this is your first time catching this series, this is where I come on live Thursday evenings to kind of talk about something that either crashes my timeline or something that someone sends to me that I just feel like I have to talk about, right? And we didn't catch last week's episode. We were not in. I got much busier doing some stuff for my wife and her organization, Autism in Black, because she has a conference coming up. So I was doing work on that end. So I didn't have time to do a live series last week. But if you were here a few weeks ago, if you caught a few weeks ago, I feel like it was almost like foreshadowing, right? Last episode prior to this, we kind of discussed how face masks were making airline passengers crazy. I definitely suggest you go and watch last week's or the last video for the Real Physician Reacts, just so you can kind of get a mental idea. But the premise was that since the onus of mask mandates have had occurred, right? We'd had unruly passengers just skyrocket. And then not a week or so later, I think it was probably like less than a week later, we had a federal judge out of the state of Florida, which unfortunately is not a shock or surprise, especially whenever I see something crazy and I see the word Florida mentioned, I just kind of roll my eyes. We saw a federal judge out of the state of Florida ruled that the CDC overstepped their boundaries and shouldn't have been able to make a mask mandate. So they say, you know what, we're striking this rule down. We're not requiring masks. And of course, as a physician, public health professional, someone with common sense, right? This kind of came out of left field. And of course, the Biden administration was absolutely shocked and surprised. And to see, right, and we're gonna talk about this federal judge who was deemed not qualified by the American Bar Association, right? Craziness. We're going to see what the mindset is of a person who decides, I'm going to rule this like unlawful, and what the dominoes were behind it, right? So first video, we're going to just kind of show kind of a clip of, looks like CBS News. They did some coverage on it, right? I want you to, I just want you to kind of see some of the reactions, because I can tell you from a physician standpoint, I was going crazy. But let's just look at some of the reactions of some of the people that were on, on flights around when news kind of broke. Let's get here. All right. I want to make sure my screen. I'll make this full screen so you guys can see that.
There was jubilation in the skies as passengers found out masks were no longer required.
No one's any happier than we are.
One flight attendant celebrating in song.
Let me come back to that for just for a second, right? Imagine you're in the middle of a pandemic. You're in confined areas, right, for hours at a time, and you have to go there, right, because you work there. And you hear that a rule has been dropped that is going to take away the protections, and you're out here singing, right, like you just found Jesus or something, right? Like just think about that, right? You are a first line worker, especially in the airline industry, right? You're the first line. You're the first person we meet. You're going to come into contact with all those unruly passengers and everything. And, part of the protection that you had was that, people had to wear masks. So they couldn't jump on a plane with active COVID or other respiratory related diseases and then come on your plane, right? Like that was a protection for you. And here you are singing and rejoicing like you just won the lottery, right? Just amazing.
Major U.S. airlines made mask wearing optional once the TSA said it would no longer enforce the federal rule. Airport officials in Houston today carting away these mask requirement signs, the nation's busiest airports all making masks optional. The White House, hoping to keep the mandate in place through May 3rd, was caught off guard by Monday's announcement. CBS's Nancy Cordes today asking President Biden for his view.
People continue to wear masks on planes.
That's up to them.
But inconsistency remains in places where local mask mandates still exist, like Philadelphia and New York City. So,
and that's a point that that definitely needs to kind of be highlighted. Let me solo myself that once this judge said, "Hey, you know what? I'm striking this mandate and making it optional." Of course, people around the United States, because it's not the world, people around the United States are rejoicing. But what occurred is that you had certain cities, and he kind of mentions it. You had certain cities like, hey, I don't care what that federal judge is talking about. If you are in my city, you need to wear a mask. So, and I've talked about this since the beginning of this pandemic. One of the biggest issues that we have had is just a level of confusion in regards to communication. So you have, if you're watching one TV show or one TV network, they're rejoicing, right? Because mask mandates are off. And then you watch another one, and then especially depending on your local market, and they're like, hey, I don't care what that judge says, you still need to wear a mask. As a regular Joe Blow patient, you're going to be confused by what you're reading or what you're seeing on TV. So already just a ball of confusion. And, you know, they kind of mentioned how the Biden administration was absolutely like surprised by the decision, because if you think a decision like this is coming down the pipeline, you want to get ahead of it. You want to kind of prep the general public, because again, that's what the decision is for. You want to kind of prep the general public, say, hey, looks like there's going to be a ruling against the mask mandate, but we want to let you know that we still kind of recommend it, right? Like you want to kind of get ahead of it. But unfortunately, because of the way it transpired and how it transpired, how quickly it transpired, it just kind of happened. And then you're left with a ball of confusion.
for now, flyers into those cities will have to mask up once they land. There was also confusion at New York's Penn Station, where travelers on New Jersey Transit and Amtrak were not required to wear masks, but New York subway and commuter rail passengers were still required to do so. And tonight, new rules of the road. Rideshare companies Lyft and Uber both making masks optional.
And let me big myself up again. And obviously that's a big thing too, right? Because not only because the judge's ruling wasn't just against airlines, it was against public transportation. So of course Uber, Lyft fell under that. And obviously they found an Uber driver who couldn't wait to rip off the mask because they wanted to breathe. Now again, mind you, we're still in a pandemic. We're still having multiple variants sprout up and cause restrictions everywhere. And this is one of these issues, especially from a news related standpoint, where I talk about how the United States becomes so geocentric that they feel they center the world. So as we speak, as I'm recording this on April 28th, you have areas in different countries that are shutting down. You have areas that are going back to mask mandates. That's happening as I speak. But if you didn't know any better, and obviously if you only focus on the United States, you would think oh my God, everything's good to go, right? Which again leads to when people ask me, hey man, when is this pandemic ending, right? Like when are we going to get over the hump? And I always say, well, I have to see what the rest of the world is thinking. Because if the rest of the world is thinking all right, we can move past forward, we can do this, all right, then I'm much more optimistic. But when I see the rest of the world operating pretty much opposite of the trend of the United States, I just have to say, well, here we go again, because this is kind of exactly what it's setting up to be, unfortunately.
And I just want to fill
free and breathe freely.
A relief for driver Gannett Abate.
Very happy. I hope this is over for all of us.
But there is still concern from parents traveling with children under 5 who are not.
And she kind of mentioned, and I'm definitely going to run by the. She kind of mentioned something, right? She hopes this is over for all of us. So when people say that, because they've been saying it for like 2 years now, I can't wait till it's over. I can't wait till it's over. So now, obviously, she's mentioning the aspect of the mask mandate being, I'm hoping, being all over. Because for a lot of people, mentally, they feel that because the mask mandate is still around, COVID is around. And vice versa. If we are loosening restrictions, if we are loosening a mask mandate, that invariably means that COVID must be getting better and we're going to the other side. And so you kind of see where that's a problem, right? You see how just because restrictions and things are getting loosened over here does not mean that we're having less COVID variants, does not mean that you're having parts of the world that's going back and shut down again. It doesn't mean that. But when you're centered here, United States, when you're centered on yourself, you really think that's how it goes, right? Like there are people who probably feel that we are long gone towards the end, ready to get out of this pandemic. We're ready to move forward as if nothing happens, right? And when they talk about this aspect of moving forward, it's always in this onus, like, let's just get over it. Like we're gonna have 1 million deaths here in the United States crossover by next month. 1 million people in a span of 2 years, 2+ years now, will have died from COVID. And that's just here in the United States. 1 million. So when you hear people talk about like, I just can't wait to get over it. Let's get over this thing, right? It reeks from a level of privilege for the fact that you happen to survive. And I talked about the 1 million people dying. All right, I have not talked about the amount of people who are going to be permanently disabled because of COVID. You know, the people who lived, but they're going to be permanently disabled from it. Again, remember, I take care of patients in acute care center, long-term care center, and rehab. I see COVID patients at all different levels, right? I see people whose lives are completely changed from COVID. I'm taking care of a patient now. Let me big myself up real quick. Taking care of a patient now who has been in the hospital system for 7 months because they had a prolonged hospital course in the acute side. Now they have a prolonged hospital course in the long-term care side. And it's not like they're going to go home from here. They're going to go right to a rehab afterwards. So imagine if this is a primary breadwinner and now you've lost your primary breadwinner for 7 months, 8 months, 9 months. They didn't die, but you lost them for 9 months. This is a reality for a lot of people in this country. So when you hear these people talk about like, oh, we can't wait to just get this over with, get it done, right? It just reeks from a level of privilege to say, hey, I survived this, man. Like, let's just yeah, I'm sorry that 1 million people are gonna die, right? Especially by the time if you're watching this by the end of May, 1 million people would have died from COVID. So when they talk about like, oh, I just can't wait to get it over with, like they're saying like, yeah, let's just stop talking about it. Because if we stop talking about it, then we don't give it the importance that it really is, right? And so that's an unfortunate, case of events that have been just continue to occur while dealing with this pandemic. Just a level of dissonance, right? And I kind of talked last week when I said the biggest issue that we've had, or biggest issue that we've seen from this pandemic, is that we recognize that there are certain people who only care about themselves. They do not care about others, right? So now when I talk about it in the sense of the United States is like, yeah, we're moving forward. Things are getting moving, despite the fact that other countries are shutting down as we speak, right? Despite the fact that other countries are going back in COVID restrictions as we speak. So despite the evidence that they're seeing out there, we're acting like we don't see that evidence and we're rolling back restrictions over here, right? Like this, but again, this is you can do this in a type of country that only looks out for itself, right? So that's why you can have an unqualified judge. And again, I'm not calling her unqualified The American Bar Association called her unqualified, right? One of the most unqualified judges to become a federal judge, lifetime appointment. They said it, not me. That's why you can have a person in that position strike down such a mandate, right? Like, it's just a level of power that, is just unfortunately sad.
Not vaccinated.
It is a possibility that we may not travel with him as much anymore.
Sarah Nelson, the president of one flight attendant union, says it will also be challenging for immunocompromised travelers.
There are people who are going to care for their loved ones who are in a very compromised position medically, and they want to make sure that they're not taking any additional risk to them.
Now, the CDC acknowledged today it is no longer enforcing its mask mandate.
So again, just to kind of give the context, right? So we have this judge, right? Again, not qualified, who was deemed not qualified to be in her position, essentially strike down this mandate that says that in public transportation, you can't require people to wear a mask, right? So despite the public health benefits of it, you can't require people to wear a mask, right? So now people are going crazy. You saw in that video, like, people jumping for joy. I saw videos where the pilots were like, "Hey guys, we don't have to wear our mask anymore." You saw this singing flight attendant, right, who was like rejoicing for the fact that now he got to be like in line with all of these people, right? Again, it's crazy. It is crazy when I think about it, and I'm trying to rationalize myself, right? Imagine because I work in a hospital. I'm taking care of patients with active COVID, and then I walk into their room, no gown, no mask, no nothing, right? Just because, right? So now when I look at this flight attendant, right, when I look at these people who have to remain in these confined areas, and they're happy about it, right? They're excited about it, right? It's just mind blowing to me, right? And again, and I don't know if it's because it's a respiratory, I don't know what it is, but I just can't think of a rationale that would allow you to be so comfortable, right? And I think that's the biggest thing for me. How are you so comfortable being in a situation that puts you in danger? Like how? What is that? Right? Imagine, let's say, again, let's take about HIV/AIDS. Imagine HIV/AIDS. One of the biggest ways to get HIV/AIDS is unprotected sex. And then you say, I'm going to have as much unprotected sex as I want because I don't care about HIV/AIDS, right? And you take that risk. Like, this is, and you have an opportunity to say, hey, if I just wear protection, right, I can greatly reduce my chance of getting HIV/AIDS. And you're like, nope, I don't care. I'm good. Right? Like, this is the mindset that I see when it comes to COVID, right? That, nope, out of sight, out of mind. If I act like it's not there, if I act like the pandemic is over, then it's really over. Then I have nothing to worry about. And you saw towards the end where they kind of mentioned, a couple of subgroups, right? And depending on when you're watching this, one of our farmers, I think it was Pfizer, recently, sought permission to get vaccine use for kids from the age of, I think, 5 months to 6 years of age, or 6 months to 5 years of age, something in that regard. It was something I could talk about later. But like, again, so there's still significant populations who do not have the ability to protect themselves, whether it be vaccination, whether they're immunocompromised and they can't even get the vaccine, even though they want to. Like, I've taken care of quite a few patients who, because of their history of immunocompromisation, they couldn't get the vaccine and ended up getting COVID and all the other sequelae from it. Right. So let's kind of take a look at, some of the, places, just so you can get an idea of, who said, what, like, I'm not wearing my mask anymore. Where are you at? Let's look at these. And this is from NPR, just so you can get an idea of the airlines that say, I'm not wearing masks. Make myself a little smaller. So to kind of start, we have, Alaska Airlines said it was optional. American Airlines We have Delta, Frontier, Hawaiian Airlines, JetBlue, Spirit, Southwest, United, right? Those were just the airlines, and we kind of mentioned how Uber and Lyft, two big public transportation people, also said like, nah, we're not doing that as well. And of course, they all, because to cover themselves, they say, hey, you know what? We recommend it, but we're not going to require it, right? Because obviously, legalese, right? You have to protect yourself, right? Now, I'm pretty sure when you and I don't need to book a ticket anytime soon, but like I would love to see what it looks like on from a ticket standpoint, right? Because I remember I went to a concert, and even at the concert, it was like, yeah, we recommend you wearing your mask. But you know what? If you don't, you don't. But by the way, legally, don't sue us if you get COVID from here, right? So that because it's still real, right? Like they're saying, like, hey, legally speaking, I can't make you wear that mask when you come in here anymore. But don't try to sue me if you happen to get COVID because you're walking around here no mask, right? So in their mind, they're like, hey, we're gonna protect ourselves, right? And that's all these airlines did, right? They say, hey, it's recommended, it's optional. If it was us, I would do it. But it's optional. And we kind of mentioned how you have certain cities, Philadelphia, New York, that are like, nah, you come to my city, you're still gonna wear a mask. So imagine you're flying from the great state of Florida, right? And you happen to go to New York and happen to go to Philadelphia, and you're thinking it's all good because you don't have to wear a mask, and then you touch down in the airport and then you got to throw a mask on, right? So again, just different levels of confusion that are just going to continue to cause problems for our population here in the United States, right? And again, and I'm recording this at the time as we're seeing, an increased number of cases, especially from that subvariant BA2. We talked about that a few weeks ago. In fact, we might have talked about that on the podcast, right? So as we continue to see increased numbers of cases, now severity, obviously, we're kind of keeping an eye on. Now, again, obviously, fortunately, because it took us a while, right? But we're 2.5 years out, right? So again, we're creeping. I think we're about 65% of the population is vaccinated who could get vaccinated. I'm not sure what our boosting numbers look like, but we're getting a good amount of our population vaccinated, which is good, right? Which means we're not like flooding the hospitals anymore, right? Which is what we did. But again, we're just kind of waiting, right? We're just kind of waiting for the next thing to happen. So what I 100% expect to see, that as you see, which is happening all across the country, as you start seeing more and more of these mask mandates, be turned optional, and more people traveling with COVID, because they will be traveling with COVID, willy-nilly, glowing across the country, going across the world, because obviously we're not just traveling here, right? We're going to the Mexicos and the Africas, and we're going to all these other places, right? And bringing COVID to them, right? And again, which I'm very fearful of, because obviously they a lot of their systems can't handle the onslaught that we could possibly handle. I fully expect us to still get variants, still have more variants to come. And again, knock on wood, fortunately, we haven't had a variant that spread like wildfire like the Omicron did, but also wasn't deadly like the Delta, right? We haven't had that type of variant, but again, we're just kind of hoping and praying that this does not occur, man. But I just thought it was absolutely crazy, for this to kind of occur, like literally a week or so out of our last video where I talked about how these mask are driving these airline passengers crazy. So I'd be very interested to see, now that, at least for now, mask bans are struck down. And I do say for now, because like as expected, the Department of Justice did file a lawsuit, right, to try to get mask mandates placed back, right? Because, and again, let me just get to that page for you guys, so you can kind of read the title. So the Justice Department, let me make it a little smaller. Justice Department appeals mask ruling after CDC mandate remains says mandate remains necessary for public health, right? So just to kind of give you an inference of what occurred. Now, the Justice Department, obviously the government, right, said, hey, you know what? We won't go after this judge's ruling unless the CDC says, hey, you know what? If I were y'all, I would probably still keep that ruling going, right? And that's exactly what happened, right? The CDC said, hey, you know what? Despite what this unqualified, again, not my words, the American Bar Association, despite what this unqualified judge says, we still recommend the mandate. So what occurred, right? And then again, just kind of again shift to that side. Justice Department goes after appeal, right? So what I fully expect that they're going to appeal, which I think we all kind of knew was going to happen, right? And then again, obviously, if they go appeal, they're going to go to a different type of judge, and obviously there'll be some fighting on where that appeal takes place. And then I think it wouldn't shock me, right? Especially if the Justice Department prevails, that you didn't turn around and see the mask mandate get put back on, right? And just imagine, right? Let me big myself up real quick. Just imagine in a month or so, or 2 months, or however long this process takes, right? The Justice Department prevails, and now the same airline agencies, Uber, Lyft, are now required to make you mask up again. Like, if you thought these passengers were crazy before, like, they're going to be, batshit crazy like there, right? Like, again, right now, mind you, I hope it goes that way, right? Because again, like I said, we're still, not only are we still in pandemic, we still have other countries who are like going back on restrictions. Like, this is what I think is mind-boggling for a lot of doctors and public health professionals. Like, we're literally seeing other countries across the world say, hey, I don't know what the hell you guys are doing, but like, you wear a mask and we're going back on our old rules, because they see what COVID is starting to they see the COVID turn up, and we're just acting like we don't see none of that. We're just like blind eye to all of that. So, right? So this is just a different level of craziness. I'm not going to understand. I will never understand. Those in the United States have already let me know loud and clear that they care for self. Not everybody, right? I don't want y'all in my comments, oh my God, Dr. Pierre said there. No, not everybody, but a good lot of y'all, right, have said it. Have said it, maybe not verbally, but you said it through your actions, right? And which is cool, because I kind of like to know where you fall in line, right? If you're one of those people who are like, will try to rationalize to death why you don't think the vaccines work, cool. I know where you stand, right? I don't have to think about you. I don't have to puzzle you. Boom, that's where you stand at. If one of those people who will rationalize, like, yeah, mask don't work, boom, I know where you stand. I'm not here to argue with you. Remember, freedom of choice is freedom of choice. Just as long as you understand that your freedom of choice can come with some consequences, right? Like, it does not absolve you from any consequences from the choice you make, right? So it's just a level of craziness that, again, we're gonna have to we're gonna keep an eye on, especially once the ball really starts getting rolling as far as the Justice Department's appeal. But I can just tell you from my personal medical opinion, right? Especially if you are traveling, right? If you're traveling, you're in these confined areas with people who ain't going to get tested for COVID, even if they're sick. They're going to hop on the plane. They'll do whatever they want. They'll hop in your Uber. If you're in that area, right, keep your mask on, right? If you're out which again, this is CDC guidelines, so I'm not saying anything crazy. If you're out in the general open public, you're moving around, yeah, take your mask off, right? Especially if you're vaccinated. If you're unvaccinated, do what you do, right? But like, you're vaccinated, yeah, go ahead and prosper. But like you're not gonna catch me going no plane. You're not gonna catch me going no Uber, right, without my mask. That ain't happening. It ain't gonna happen one way a bit, right? Like, it just is what it is, man. So again, we ain't gonna talk your head off. I'm yours truly, Dr. Pierre, favorite board certified internist, host of Real Physician Reacts. Make sure, especially if you're watching this on YouTube, make sure you subscribe to the channel. If you're not watching this on YouTube, go to my YouTube channel, drbarrypierre.com/YouTube. Go to my YouTube channel and subscribe to our YouTube channel and prosper, right? So you guys be blessed. I'm going to see you guys next week on Medicine Mondays. Make sure you check that out. Make sure you subscribe to the podcast as well, because the podcast episode drops on Wednesday. You guys be blessed. I'm going to see you guys.